I liked working with kids, therefore I went into pediatrics. And once I was in pediatrics, I realized that the part of pediatrics that I liked most was developing relationships with families. In the NICU, babies are often very sick and often in the NICU for a prolonged period of time. And being in the NICU every day, I get to interact with those families and really get to know not just the babies, but the families too. When people get pregnant, they don't expect to meet me. These are almost always situations where it's sort of out of the blue. Usually when I meet parents or when my team meets parents is before the delivery, ideally. We have an opportunity to sit down and talk with the families, talk with the moms about what our expectations are, especially if it's a preterm delivery or if it's a baby who has some birth defect. We can talk with them ahead of time to give them some sense of what to expect, where the baby is going to be taken care of, who the team is going to be, what our expectations in terms of what are the steps in making their baby better, what is the timeline for getting their baby home. Ideally, parents are there during rounds, just so that they can hear exactly what the issues are, what the new issues are, what progress we're making. We know that parent involvement is a huge piece of achieving the goal, again, of getting them home. Parents who are involved, both short-term and long-term, their babies do better. Families are experiencing one of the most terrifying things that they could ever experience and will ever experience in their lives. And just watching how they respond to what their baby needs and respond with the team that's taking care of their baby, it's amazing to see.